Dr. Herb Riemenschneider of Riverside Urology in Columbus, Ohio, will discuss his experience with HIFU, high-intensity focused ultrasound. He's performed over 70 cases, both abroad as well as in the United States, and contributed cases that were included in the study that resulted in FDA approval.
Good morning. I'm really honored to be speaking to the 2018 Ohio Urologic Society meeting, and I'm thrilled to tell you about my experience with the new technology, high-intensity focused ultrasound, known as HIFU. I think this therapy is going to change the way both patients and physicians think about prostate cancer and make a complicated problem a big problem, a simple problem, and much less of a problem for both. HIFU, a new therapy, has just been granted approval by insurance for application for treatment of prostate cancer. This is a remarkable early step in this new technology. Prior to this time, prostate cancer is the only disease that remains where we make the diagnosis by biopsying at random, in many cases, the organ system. And as you can see in this simple drawing, it can be missed and yet have a significant problem present. We now have high-intensity focused ultrasound combined with the diagnostic capacity of multiparametric MRI. And this is the Dynacad system, which essentially creates a map for us to know where the problem most probably exists in the prostate. And this gives us guidance at both biopsy for diagnosis and treatment. I'd like to share a case with you. Here is on the T2 axial scan of the MRI, a lesion. And this is the focus of our attention. We'll notice that this patient has a significantly elevated PSA. Now, MRI, compared to the transrectal ultrasound biopsy, is much more sensitive, 93% compared to 48%, and its negative predictive value, which I think ultimately will be its biggest advantage, because I believe that shortly we'll see the MRI, multiparametric, used as a screening study that will give us early direction and the ability to diagnose prostate cancer more efficiently than we do today. Now, this is the biopsy system that we currently use. With the Dynacad direction, we know where the problem in the prostate is likely to exist, and using the precision point transperineal biopsy, which was developed by Matthew Alloway, urologist, we have been able to be very precise in understanding the location of the disease when combining it with the MRI. This is the precision point system mounted on an ultrasound probe in such a way that we can present the local anesthetic that makes this possible comfortably for the patient with just a little Valium sedation. And this procedure is done in the office in many, if not most cases. Here we can see the precision point system being introduced. And here, now that it's introduced, we can place a biopsy needle, and we can then use ultrasound to understand the trajectory of the needle. Here we're putting the local anesthetic in, and you can see it spreading around the prostate, creating a field of anesthesia. Now we know there are two lesions in this prostate, and this is actually the biopsy occurring in the inferior lesion and now the upper lesion. We use this map to denote where the biopsies have come from, and if you look over here, you can see the orientation of the biopsy, and it's a very precise system to give us direction for both understanding the disease and ultimately applying treatment. Here is our lesion once again that we have now identified with the ultrasound. And this is the B2000 diffusion weighted image that confirms that this tissue clearly is abnormal. Now the question is, how does high-intensity focused ultrasound work? Well, all of us in this room have used a magnifying glass, most likely to start a piece of paper on fire or maybe etch our initials into a piece of wood. And we know that by using the sun's rays and concentrating them at a point, this is very hot and allows us in a very precise manner to create heat in this point. And yet you can put your hand between the magnifying glass and the area where these rays are focused, and it's not even warm. This is the methodology that gives us the opportunity to provide high-intensity focused ultrasound at a precise point within the prostate where we have previously identified a malignant and obviously pathologic lesion, and we use the very same principles as I was showing you with the magnifying glass. This transducer is very special. Being an ultrasound transducer, it gives us imaging so we can see where we are located, and it also then provides the energy concentrated by these transducers, much like the magnifying glass, to give us very precise location of the heat that is generated to destroy the bad tissue. And here are the principles. Here's a very low energy source, about 15 watts of ultrasound energy, yet magnified to close to 2,000 watts at that precision point of application. Very high energy density. This is the ultrasound system of HIFU in place. Now, I know it doesn't look like it, but this is non-invasive. And what we mean by that is we haven't broken any body barriers. So this ultrasound probe is in the rectum with the transducers as I've described them to you, and we can provide the treatment to the area of the prostate involved. Now, as we sit at the console, this is the image of the prostate that we see, and we can then guide that energy to areas where we know there are problems, which in this case would be prostate cancer. Now we can deliver this in a very precise manner and only destroy the lesion, the area that's bad, and a margin around it. This is representative of the ultrasound energy. It's very precise. It's cool, very much close to the energy, but very hot within it. And this then, with precise delivery, will destroy the focal area, which is the cancer. This is another screen when our treatment is completed, and it demonstrates the area where we have applied the energy. This energy has been applied within the prostate and not outside the boundaries of the prostate. And here we can keep a record of the areas that we have treated. And this is the mechanism of delivery. And again, the precision is the key issue, and the tissues right next to where the heat is being applied are actually cool. And this allows us to do things that we'll share with you. Now, here at 180 days is the same area after treatment. And this shows resolution, and this is the healing of the area where the cancer existed. And the PSA, as you will remember, was in the 6 range and now has dropped dramatically. Why do we still have PSA? Because we only treated this part of the prostate. The rest of the prostate is functioning in a normal manner. Now, at 180 days on the long B diffusion-weighted image, there is no lesion, indicating that we have destroyed the disease presence. Now, one of the big values of this is that it doesn't disrupt urinary function. Here we still have the prostate intact. All the little nerves that supply the areas of function, such as urinary control, are intact, going to the shutoff valve, the sphincter. The internal sphincter at the bladder level is intact and working appropriately, and the little nerves that come along the side of the prostate and go out into the penis to allow reactions such as erection to occur have been undisturbed, and yet the area of the tumor has been totally eliminated with this precise therapy. These are the neurovascular bundles that are outside the prostate, and we can treat very close to the neurovascular bundles but preserve them and destroy disease that may be in the area nearby. And I think this view of an actual patient being treated shows you just how close we can come to the neurovascular bundles. And that's the beauty of high-intensity focused ultrasound, the precision of delivery. Nerve sparing, as done in open or robotic radical prostatectomy, can clearly be done. We use a color Doppler to guide our treatment plane so that we don't disturb the neurovascular bundle, and the treatment is actually taken to the edge of the prostatic capsule but not to the outside, and the outside is cool while the inside area, which contains disease, has been destroyed by the ultrasound heat that I've described. Since the FDA approval, and our experience began in June of 2016, we treated 31 patients. 27 patients have 9-month mean follow-up and are free of disease. One patient had an infield recurrence, and treatment for that is pending, and very likely will be a second treatment with high-intensity focused ultrasound. 3 patients outside of the field of occurrence have disease, but it's very low-grade Gleason 6, and they are all involved in active surveillance, doing well and not having evidence of progression. All patients are continent. All patients that had erectile function before the treatment have had it after the treatment with or without phosphodiesterase 5 inhibitors, otherwise, as we know, Viagra, Cialis, or Levitra. This method of treatment has been used in England for more than 10 years. Dr. Mark Emberton at the University College London and his colleagues, not just at the college, but across London, have reported a study of 625 men diagnosed with intermediate or high-grade and small or moderate volume prostate cancer, now that has a median follow-up of more than 7 years. Here is Dr. Emberton's poster that was presented at the AUA 2 years ago. This deals with urinary continence that's pad-free, and 98% of the patients are dry. Erectile function was preserved in about 85% of cases over a follow-up period. This graph demonstrates the survival based on a Kaplan-Meier analysis, meaning that these patients are, by all parameters, disease-free. And here is the survival curve that shows no evidence of metastatic disease. These graphs now represent not 5-year experience, but 7-year experience, and they haven't changed, and the outcomes are viewed as excellent. The patients are 97% of them are disease-free. The overall survival is 99%. Focal HIFU is an outpatient procedure, has a rapid recovery, low risk of erectile dysfunction or urinary incontinence, and patients who travel from out of the city for this therapy frequently go to a restaurant with their family the evening of treatment for dinner. If this process of change sounds familiar, it should. Ironically, we are here in Cleveland talking about this. George Kreil, son of the founder of the Cleveland Clinic, in 1973 made a change from radical mastectomy to lumpectomy, and we know now that this has become the standard of treatment for most breast cancer. We believe that HIFU, as described, or a process that is quite similar, will become the standard of care for early diagnosed prostate cancer. Thank you. This is our website where a lot of the information that we have talked about in a very brief period is explained in more detail, and I encourage you to look there to learn more about this fascinating, revolutionary technology that is going to change the perspective of prostate cancer by both the patient and the physician, taking it from a big problem and a complex problem to one that's a small problem and efficiently cured with this technology. Thank you so much for your time. Well, I want to thank you again for giving me the opportunity to share this experience. It's been quite a journey, and I've been very pleased, as the patients that I've been involved with have been pleased. Our follow-up domestically in the United States, in our particular experience, is short, but it certainly parallels our offshore or experience abroad, and we anticipate that these high success rates are durable and will continue. And I look forward to seeing this applied to a broad spectrum of gentlemen who are, as we now know, can be diagnosed as early as the late 30s, early 40s with this disease, and the disease can be eliminated in a way that really disrupts their life minimally, and allows them to be functioning family members and sexual partners. And when you interview or discuss in follow-up with these patients, you can just see the joy in their face and their eyes and their families at the time they're with them. Thank you again for giving me this opportunity.